to today's event, Rethinking Vaccine Hesitancy. Before we start, just a little bit of housekeeping. Today, Maya will be answering questions at the end of her talk, so please do put any questions you have for her into the Q&A box. Introducing our speaker now. Maya Goldenberg is Associate Professor of Philosophy at the University of Guelph and a member of graduate faculty at the Institute for History and Philosophy of Science at the University of Toronto. Her research is in philosophy of medicine, philosophy of science, and bioethics. She is author of Vaccine Hesitancy, Public Trust, Expertise, and the War on Science, published by University of Pittsburgh Press to 2021, and Journal of Publications addressing philosophical issues in evidence-based medicine, vaccination, clinical care, and women's health. Today, she will discuss her new book on vaccine hesitancy.
Thank you. Thanks for that introduction, and hello, everyone. I wish we could be here in person, but pretty soon, we hope. So I'm going to begin. So my talk today is Rethinking Vaccine Hesitancy. As mentioned, this is research that came out of my new book, Vaccine Hesitancy, Public Trust, Expertise, and the War on Science, which just came out, of course, very timely with the rollout of COVID vaccines, but this work started years prior. So I'm happy to share it with you, and of course, to make some parallels between my research, which I should say was on vaccine hesitancy, pediatric vaccine hesitancy in industrialized nations. And of course, it's been an easy pivot to vaccine hesitancy around COVID vaccines too. So I'll begin. This is where I began. My work began with I was generally interested in the controversy surrounding childhood vaccinations. The situation in industrialized nations presents this puzzle, that we're against a strong scientific consensus on vaccines and very consistent messaging and relatively good access to vaccines. Vaccine hesitancy persists. So that's the trouble that many people have opined on and commented and thought about. So when I started this research, I started in earnest around sort of 2015, maybe a little earlier. I wanted to figure out what evidence was going to convince them. The answer to this question, what answer is going to convince them? The answer turned out to be more complicated than I thought. In fact, I was even asking the wrong question. That's when the work really got interesting. If vaccine hesitancy isn't an information problem, and I'm going to tell you it isn't, if it's not a communication problem, then what is it exactly? So I'd almost completed the final draft of my manuscript, my book manuscript, when the novel coronavirus was first identified. So this is, as mentioned, pre-COVID research, but the themes that I address around vaccine hesitancy, namely public trust in scientific institutions and the problem of expertise, are, I think, as relevant as ever. And so are the arguments that I offer against the dominant thinking about vaccine hesitancy. So just to characterize them, I argued against the popular view that vaccine hesitancy stems from some members of the public's problematic relationship with science. In other words, I'm saying that poor scientific literacy and in some cases, science denialism are thought to be the cause of vaccine hesitancy, but I reject that view. I also argued against the widely held view that vaccine hesitancy in industrialized nations is a problem of affluence. The profile of a vaccine hesitator is characteristically white and affluent, but there is good reason to think otherwise, I argued, and to do the empirical work to establish this. The empirical work has not established that yet, and I can speak more to that. So I argued a view of vaccine hesitancy as a bellwether or an indicator of social fraction. And the COVID situation actually throws some of these signs and symptoms into sharper relief than pediatric vaccine hesitancy did. So today I'm going to focus on the first argument on your slide, the idea that vaccine hesitancy is not a signal of the problem vaccine hesitancy does not signal a problem of the public's scientific misunderstanding or science denialism, or what I called a war on science. I'll define that a little better for you. So I'm going to argue against that case. That second point will be shown to be implicated by the argument against the war on science, but I won't be able to give the second point the attention it deserves. But I'm happy to go into that during Q&A, this question about who is the profile, who fits the profile of vaccine hesitancy. Okay, so to start us, I'm going to start with the definition of vaccine hesitancy. The definition I use, and it's not unique to me, it's found in the public health research, is a feeling of ambivalence about vaccines or vaccination. So it's an attitude. Vaccine hesitancy is an attitude. It's not a behavior. The behavior of interest might be vaccine refusal, but we're talking about the feelings that lead to that kind of behavior. Vaccine hesitancy, of course, can predict behavior, but it doesn't guarantee it. Some people hesitate and still vaccinate their children according to the schedule or get the COVID vaccines. Others hesitate and refuse all vaccines. And there was a growing effort to do modified schedules for children's vaccinations, where you do some vaccines, you skip others, you space them out longer, or you start them when your children are older. That was a growing trend. And public health scholars agree that we need to keep an eye on the attitude, not just the behavior, in order to protect public health. And this point of interest, hesitancy, exclusive from behaviors and other issues around immunization, it led to the formation of a WHO scientific advisory group of experts, or SAGE, focused exclusively on vaccine hesitancy. They convened in 2012. So what I'd like to do today is challenge the way we usually think about or frame vaccine hesitancy and refusal. Frameworks, of course, are important. They structure how we view the problem, and also they structure how we respond to it too. So I want to look and assess the assumptions and values lying beneath the dominant framework. I call this framework the war on science. And I'll suggest a new alternative, a new framework, or an alternative framework, which I call the crisis of trust. So to get into that, let's start with how should we understand public resistance and controversy over scientific claims. These examples include, of course, resistance to the consensus on vaccines, but it's not limited to that. We could talk about climate change controversy, GMO opposition. Those are also examples of highly politicized discussions of scientific issues and strong public responses to the proposed policies. So these controversies are usually framed in combative terms. The combatants are science versus nonsense, reason versus ignorance, expertise versus non-expertise. And we hear that science, rationality, and expertise are losing the war. There's victims of this conflict, of course. Public health and well-being are at stake here. And when asked who is responsible for this, it's members of the public, at least some of them. When members of the public turn away from science and rationality, say when they refuse vaccination or they deprioritize political action on climate change, they fail at the task of informed democratic participation. That's the dominant view. And you'll see this view routinely made in many forms of media that address public resistance to scientific claims. This is quite a popular topic that a lot of people like to give opinions on. So I tried to get a handle on how people characterize the problem. I looked at academic work, popular science writing, many opinion pieces in newspapers and magazines. And in these writing, you can see some very definite themes. You'll find commentators bemoaning scientific illiteracy among the general publics. This is one example, a book written by a journalist and science communicator, Americans, called How Scientific Illiteracy Threatens Our Future. And you'll also see commentaries that fret over a destructive cultural embracing of anti-intellectualism and the end of expertise. That's the idea that no one listens to experts anymore. These are very common themes in discussions regarding public resistance to scientific claims. I wouldn't be surprised if they sound familiar to you too. I saw these themes again and again. And this public resistance towards even very strong scientific consensus claims are seen as a key problem of our times. We are now allegedly post-truth, post-fact, anti-science, and this culture war on science and expertise only gets amplified when you add a pandemic. COVID-19 is described in this public health paper as our first post-truth pandemic. And the authors explain how I'm quoting from them, in our post-truth world, the line between fact and opinion fades. Being caught in a lie no longer guarantees negative consequences, and the phrase believing is seeing has transformed from a psychological insight into an accepted way of life. Although the roots of this epistemic crisis are clearly visible in the anti-vax movement and climate change denialism, COVID-19 may be our first post-truth pandemic. So if I had to describe this as a whole, I'd say what's being described here is a culture war on science and expertise. It's taking place on social media platforms. It is impacting us all. So that's the dominant view I want to challenge regarding vaccine hesitancy and public resistance to scientific claims more generally. So returning to that previous division, I'm going to argue that this is not a war on science and expertise. I will acknowledge it is tempting to see it that way when members of the public repeat pseudoscience that they pick up on the internet, when they don't listen to their doctors about vaccines. It's tempting, it seems to fit. But I'm still going to make the case for the alternative framework of the war on science, which is a crisis of trust, specifically public mistrust of scientific institutions. And this alternative framework rests on a different conception of the relationship between science and society. What is this thing called science, the nature of science? How do the publics relate to science? And this differently posited relationship encourages different public health outreach strategies than are currently being used. And it also redraws the lines of moral responsibility for the problem. Specifically, the problem no longer lies squarely in the epistemic failings of the public. Also, of course, I'll say more about that. So let's start with the nature of science. So the nature of science and the role it plays in politics and policies. So in the war on science, there's a few ways you might think about what's going on. You may think the driver of vaccine hesitancy and refusal is the public's low scientific literacy, a very common view. Or you might think that some willful science denialism and active anti-expertise is happening. That's also a popular view. But before I go into those, I want to point out here that these explanations share something in common. It's a grounding assumption about the role of science in democratic decision-making. In both accounts, there's this thing called science that transcends partisan politics, and a failure to recognize this rightful anchor in liberal democracies is damaging. So instead of the usual point form, I use this image instead, an image of a boat and an anchor to capture the assumed role of science in democratic society. So here, science provides the anchor for the swells and surges of democratic choice. And by doing that, it rationalizes the will of the people or majority rule. So public misunderstanding of science, the death of expertise, similarly untether decision-making from its rational basis. So that's why the stakes seem so high, because there's so much to lose here. So whether it's a war on evidence, whether it's a war on experts, public resistance to scientific claims is similarly envisioned. It's a battle between established knowledge and everything else. Public health organizations often have good scientific backing for their directives. No question about that. It's then assumed to follow that public health has exclusive claim to knowledge and to rational policy. It's also assumed that the problem lies in those who cannot appreciate the science and the science-backed policies. That's the thinking about vaccine hesitancy and other forms of public pushback against scientifically backed policies. So I'm going to agree to the scientific superiority of the vaccine consensus view, but I'm going to challenge those other claims that the best policies follow from the best science and that the publics are the problem. So I hinted at this already, but I'll say it again. I'm working against a popular and admittedly tempting way of thinking about controversies over well-established scientific claims, where disagreement about, let's say, the safety, disagreement about vaccines, for example, represents a war over scientific evidence. This is a very common perception, common enough to make the cover of National Geographic magazine. This was March 2015, and it's repeated by leaders who feel the need to declare allegiance to science. So just a few examples, quick. Here's the former head of the CDC, tearily vowing to uphold science. This was in his inaugural address. Here is Hillary Clinton in 2016, telling the Democratic National Congress that she believes in science. And my own Prime Minister, Trudeau, had similarly expressed allegiance to science upon taking office in 2015. So I say this view of the problem is tempting because in many ways the description seems to fit. We've got this huge body of literature supporting the scientific consensus. We've got opponents picking out selective and often disreputable counter evidence. The public seems to get caught in the middle. Sometimes they choose wrongly. And the reason for public resistance to these claims, like vaccine safety or climate change, it is argued, is because the public misunderstands the science or they lack sufficient scientific literacy. That popular science communicators strongly endorse this view. Here on your screen is Neil deGrasse Tyson, probably the most well-known English language science communicator, saying scientific illiteracy is a tragedy of our times. And he references vaccine hesitators along with other science transgressors as examples of this. Science communications, as a result of this strongly held view, tend to focus on knowledge transmission, especially debunking myths. I'll just give you a few examples. This is a few examples that largely represent what vaccine communications to the public look like. And in all of these slides, these images here, you see facts versus myths, just the facts, debunking myths, and sometimes they use clever phrasing like inoculating against misinformation. But you see what the sort of characterization of the problem is and what the outreach looked like as a result. Now, parents do, of course, seem to be rejecting science when they explain their reasons for vaccinating about, for hesitating about vaccines. There's lots of surveys, there's interview transcripts, and parents say things like vaccines aren't safe, vaccines aren't effective, vaccines aren't necessary. So they make these evidentiary claims in direct contradiction to the consistent message offered by their physicians, by public health agencies, and so on. So this framework seems compelling for those reasons. But still, there is strong reason to challenge the pervasive explanation that the public misunderstands the science. Here's a few. If misunderstanding and misinterpretation of the scientific evidence were the problem, you would expect providing accurate information and education to correct this, but they don't. There's been years of well-funded education campaigns, and they have not changed the numbers of vaccine refusers. Vaccine hesitancy numbers are even going up, slowly, but they are going up. Maybe that shows some success in the campaigns, but it's certainly not turning the tide the way you would expect it to. Another reason to think poor scientific literacy is not the root of the problem is that vaccine hesitators are often well educated. Social science research has found higher vaccine hesitancy among university degree holders, even postgraduate degree holders. So the more likely story about what's going on there among those with higher education is that educated people are putting their critical thinking skills to use. Some are downloading and reading the scientific papers, and many more are allegedly reading between the lines to see what the establishment doesn't want them to see. So even if we allow for a few missteps in individual reasoning, cherry picking the data, misattributing correlation for causation, poor scientific literacy is not the key problem driving vaccine hesitancy. Now, some war on science type explanations of vaccine hesitancy go even stronger than this presumed knowledge deficit that I just described. They say, you know, education efforts are not lowering vaccine hesitancy. So they acknowledge it's not working. It's not lowering vaccine hesitancy because vaccine hesitators and refusers cannot be reasoned with. It's a lost cause. Compulsion is the only way. The war on science has also been parsed as the death of expertise or the end of expertise. In the middle of your screen, you see the book cover of a 2018 book by the political scientist Tom Nichols. So he coined the phrase, the death of expertise. It made it onto the New York Times bestsellers list. So apparently convincing was his position that no one listens to experts anymore. So in the book, he laments the real-time realization of the Dunning-Kruger effect, that this idea that the public think they know better than experts, and science denialism and irrationalism can thereby thrive. That's the view there, a widely held view. Now, moving away from popular science, and I guess Nichols' book would count as popular politics, moving away from the popular writing to the academic texts, I, of course, went to science and technology studies or science studies more broadly because I knew this is the area that should be informative because it researches these questions about the nature of science, its relationship to society, the status of scientific expertise, that kind of thing. It is actually surprising to me that many scholars take up some form of the narrative of science denialism and this public embrace of irrationalism, which is consistent with the war on science framework. So there's been a number of heavyweights in the field. I'm thinking of Latour, Kitcher, Collins, and they have recently wondered if the discipline's 50 or so years of critical science studies showing the extent to which science is socially constructed, might that have contributed to the current frustrating situation where scientific experts are not seen as more reliable than non-experts and everybody's kind of got a point. I'll give you an example. The work by sociologists Collins and Evans, they wrote the book Rethinking Expertise to address this very problem of the downgrading of experts in the public eye. And they initiated this new area of science studies working to reclaim the status of experts and expertise. They called it the third wave of science studies. And they describe in the introduction to the book a troubling societal trend towards a distrust of experts. Collins then wrote a popular science book called Are We All Scientific Experts Now?, which rehashes the argument from the 2000 book. And in it, he coined the phrase default expertise. This is the problematic idea that everyone is an expert or no one is an expert. Instead, we've got this leveling of epistemic expertise where everyone's kind of the same in terms of expertise. So default expertise is meant to describe this sense of empowerment, the sense that every citizen is part of the game of science and technology. That's Collins' text. It is the feeling of the right to judge that ordinary citizens think they possess because science and technology are so fallible. So default expertise is supposed to explain the apparent reasonableness of telling worried parents to do the research and decide for yourself, and the energy with which some vaccine hesitators take up that challenge. Some really put a lot of effort and work into their research. I know because I get communications from vaccine hesitant people all the time, and it's usually very informative, citations, all kinds of texts they want me to read. Anyway, we can talk about that later. Collins wants to save sociology of science as much as he wants to save expertise. So he plies his trade to provide a response to those armchair researchers or default experts investigating pediatric vaccines, usually for their own children, for personal need. So he borrows from the periodic table of expertises that he developed with Evans. This appears in their 2008 book. And it details the many kinds of expertise that are available to us. He focuses on the contrast between two key kinds of expertise, primary source knowledge and interactional expertise. They are circled on the table. Primary source knowledge confers the kind of expertise that an informed non-specialist can gain from reading scientific papers, from reading the primary sources. Interactional expertise is specialist expertise. It is the knowledge and understanding that comes from being part of a specialist community. So a parent who is well-read because they access scientific papers can have this primary source knowledge expertise on vaccines. But this is different from interactional expertise. They don't have that. Interactional expertise is only held by those who are members of the relevant expert community. It's only this expertise that gives you specialist knowledge. That is the knowledge required to pronounce on the knowledge claim in question. So the upshot, this is following Collins, the upshot is you can read all the online stuff you want, or you can read the professional scientific literature from the perspective of an outsider or an amateur. You will absorb a lot of information, but you will never have interactional expertise. That's the sort of expertise developed by getting to know a community of scientists intimately and getting a feeling for what they think. Collins explains, if you get your information from the journals by reading papers, you can't tell whether a paper is being taken seriously by the scientific community or not. You cannot get a good picture of what is going on in science from the literature alone. So Collins' answer to the question, are we all scientific experts now, is no, and interactional expertise is the key concept here. Even if everyone is an expert at some things, that doesn't confer specialist knowledge on everyone. Vaccine skeptics will often insist that they are experts on their own children, but that doesn't make them experts on vaccines, Collins would argue. Specialist knowledge arises from education and work and immersion in the community of experts. So best to leave judgments of vaccine safety and efficacy to the scientists. Okay, so this is how sociologists of expertise reclaim expertise. They tell us that scientists can do better in their communications and in their policing of occasional transgressions like fraud or various forms of misrepresentation. But the heart of the problem lies in the public's confusion about the nature of expertise. Once the public understand that we are not all scientific experts, expertise can be restored and public controversy over scientific claims can end. So the knowledge deficit is thereby filled by a better understanding of who is an expert and why are they experts. So in this argument for the special nature of interactional expertise, I noticed is an acknowledgement that knowledge arises in community. This idea that knowledge is social, that science is social, is a key claim in social epistemology. I think Collins' acknowledgement of the social nature of scientific knowledge is right, but it doesn't go far enough. A key feature of this communal or social exercise of knowledge building is the building of trust and maintaining of trust relationships. That's because all relationships are built on trust, including knowledge relationships. So we need to attend to the way trust figures into this social exercise of knowledge building. And that gets me to my preferred framework, which is the crisis of trust. So what I'd like to do now is take the picture of science as communities of knowers, something that Collins and sociologists of expertise will confidently subscribe to, as they should, I think. But I want to take it in a different direction. I'm going to characterize public resistance to science and the so-called death of expertise differently, not as a move towards irrationality or a reflection of scientific misunderstanding, not as a war on anything, but rather mistrust of scientific institutions. So to make the case that the problem is poor trust and not poor regard or poor understanding of science, I'll need to demonstrate the ways in which science and trust are linked. So I'm going to present trust as endemic to science. Trust figures into knowledge creation, in the managing of dissent and disagreement in science. It plays a part in consensus building and the legitimation of consensus. So generally trust goes all the way through the things that we call scientific practice. Poor trust relations undermine scientific practice and policy. And I see vaccine hesitancy as a symptom of a trust deficit, specifically poor public trust in medical and scientific institutions. Because these institutions need public trust to achieve their goals, especially their public-facing mandates, public resistance to scientific claims is not squarely a problem with the publics, but a problem of scientific governance. And that invites new ways of addressing vaccine hesitancy. So first, what do we mean by trust? This is a heavily theorized concept in ethics and philosophy of science and social theory, with particularly good attention provided by feminist theorists in all of these domains. Feminist research focuses on relational aspects of morality, of knowledge production, and social structures, especially relationships involving imbalances of power between participants. So I think for that reason, feminist research has been particularly good on trust scholarship. The concept of trust is taken to mean having confidence in someone or something. There, the definition is like pretty uniform across these areas of research. Discussions about trust in the context of science usually is about epistemic trust. To invest epistemic trust in someone is to trust them in their capacity as a provider of information. I'm using Wilholt's definition here. When we trust a person or an organization or an institution, we're judging them to be dependable and worthy of our confidence. So epistemic trust is more than just mere reliance on someone as an informer. It's the kind of dependence that makes the trusting person dependent on the trustee's goodwill. This dependency on other people's goodwill makes us vulnerable. We may be harmed or misled when we trust the wrong person. So trusting others is risky, but it's also unavoidable in order to get through life. We need to trust people in order to know things. So this tension between the risk and the unavoidability of it invites ethical analysis around trusting relationships. When we find ourselves in situations where we lack adequate information to know for ourselves, and this happens often, every day, we need to trust others. Yet we know this risk that the trust might be broken. Trust requires what's been described as leaps of faith in the sociology literature. This is influenced by the work of George Simmel, but it's still being used today in the contemporary work of Guido Mollering, among others. So this leap of faith refers to a necessary bridging of an information gap in situations of risk. So epistemically dependent people that need information, will fill any perceived knowledge gap with a kind of suspension or bracketing off of uncertainties. And the confidence with which the trustee leaps is captured in the expectation that the trusted experts has goodwill or good intention. Sometimes we can be less morally demanding. We say we have an expectation of moral integrity by the person we are trusting for information. McLeod makes that point. There's the additional expectation that the expert that we are trusting will be properly motivated to act. So the confidence we have in expert sources hinges not just on the epistemic credentials of the expert, but also on their moral character. Hardwig spoke about this in his work on epistemic dependence. So there's been qualitative research into parental decision-making regarding vaccines that have highlighted multiple leaps of faith taken in the face of incomplete knowledge and anxiety over future unknowns regarding vaccination choices. On vaccines, parents tend to get advice from people they know, from relations of familiarity. So they can be their peers, from family members, from health professionals, and those trusting leaps will be taken or they'll be denied. Trust is thereby a means of social cohesion or connection. Barbara Mistow made that point, a sociologist, Barbara Mistow. And that social cohesion or connection happens through our affective commitments or emotional ties. So what's important for our discussion here as I talk about relationships and emotional or affective commitments is that it is not the growing mountain of data that are convincing parents to vaccinate their children, but a willing leap in favor of the scientific consensus. vaccine hesitators will situate themselves in different spheres of familiarity that disqualify the majority view on vaccines. So there's actually a symmetry between the two, the parents who vaccinate their kids and the parents who don't. It's not that one side is more informed and the other side is uninformed. Parents make these calculations, they move towards in-group belonging. We are social in that nature, and we do that. So this social exercise of moving towards belonging, not that the information is irrelevant, but it's only part of the work that's happening here. The social exercise is not explained by cognitivist perspectives on risk assessment. So I think the moral theorist Annette Beyer was correct to describe trust as cognitive, affective, and conative. So there's a lot more going on here than the information, receiving of information. So that's what we mean by trust. And now let's move into trust within scientific communities. Of course, science is thought to be rigorous by being wary of trust. Don't listen to the authority, examine the evidence yourself. That's the popular understanding of science. And that made an alternative thesis that came out of science studies starting around the 1980s very radical. And that alternative thesis was that trust relations make scientific progress possible. So against the Enlightenment ideals of epistemic individualism, where you study for yourself, and radical skepticism, where you trust no one, a compelling case was made for epistemic dependency and trust in science. So scientists will trust in the peer-reviewed knowledge that supports their own work. They'll trust their collaborators to do their piece of the project properly. No one scientist has the time or expertise to do all the work themselves or to check every claim. That's not to say that hard data and logical argument are not necessary, but since not every scientist can do the singular effort of testing each claim, much of what gets counted or what we consider as scientific knowledge is based on relations of trust. So against that lone genius image, science today is a collaborative exercise of partnerships and relationships of trust operating between actors and between institutions. They are operating most of the time invisibly, and that's what keeps science going, not the radical skepticism that we sort of hold up as paradigm. So behind the scenes, trust operates in establishing and legitimating knowledge as true and universal. And by that, I mean true for everyone. Okay, so let's leave scientific communities and let's move to the public stage. This, of course, is the site where vaccine controversy takes place. When you move from science communities to the relationships between science and the publics, epistemic dependency and trust in experts actually becomes more visible and more obvious. Members of the public will rely on scientific knowledge to inform everyday choices and practices, everything from should I vaccinate my kids to should I take an umbrella when I leave the house. We, members of the public, don't have the time and skill to check every claim for ourselves, so we will look to experts for advice. We often do that. And when the channels of knowledge translation and mobilization work well, this move from expert advice to non-expert action can go very smoothly. But we're talking about vaccine hesitancy today because those relationships between experts and non-experts are not so secure. Members of the public are arguably well advised to defer to scientists with the relevant expertise. Those scientists' interactional expertise makes it likely that their judgments will be better than our own. So I think we all agree that the public benefits from well-placed trust in experts. The challenge is knowing when that trust is well-placed, because the risk of harm, of being misled, remains. So members of the public will try to reduce that risk by assessing expert advice. We're presumably not qualified to assess the content of scientific claims, but we can evaluate the character of the scientific expert or the integrity of the institutions they represent. And that's what people do. Members of the public will follow expert advice if we trust those experts to be both epistemically and morally responsible. And a number of philosophers, John Hardwig, I've already talked about before, Kevin Elliott, and a few others have detailed those epistemic and moral qualities we look for in a trustworthy expert and sort of outlined the ethics of expertise. There's a few versions out there. So the rationality of following expert advice hinges on trust and credibility. Experts must be trustworthy, and non-experts need to recognize them as such. So in epistemology, we make that distinction between trustworthiness, someone actually being trustworthy, and credibility is being perceived as trustworthy by your stakeholders. So relations of trust mediate successful exchanges between scientific institutions and the public. Of course, relations of trust don't preclude disagreement and controversy. In scientific communities, disagreement and dissent between its members are not only expected, but they are encouraged. And it's trust that helps, trust relations that help manage those disagreements. So we've got all kinds of avenues for managing dissent and disagreement in science that follow from a generally accepted democratic orientation towards truth-seeking and consensus building, one that is public and accountable. That's, of course, the ideal of science. That's what we'd like it to be. The social epistemologists like Longino, Kitcher for sure, they view these mechanisms favorably and even make recommendations to improve the democratic tenor of science. So they recommend things like increasing diversity in scientific communities to make dissent and criticism more robust. That's good science. The recommendations for limiting spurious dissent, things like the Merchants of Doubt, where dissent that is meant to be obstructionist rather than knowledge seeking. I should say that DeMello, Martin, and Intamin have written a book on dissent, and they think these efforts to regulate dissent will ultimately fail. But that doesn't stop people from trying to weed out the bad dissent and keep the good dissent, because it's so good for science. So it's with these communicative practices in place that robust scientific consensus can arise on some issues, while points of disagreement can still respectfully endure without rupturing community cohesion. Now compare that to public controversies. Science controversy on the public stage is not so well managed. We don't have comparable shared rules for the management of disagreement and for consensus building. We don't have shared frames of reference. Now we live in a time where we've got facts and alternative facts, and which one is legitimate science and which one is junk science. We've got conflicts of interest on both sides often. So the science controversy, as if that's not enough, and that already is a lot, the science controversy usually isn't about science at all, but what follows practically from accepting the science as true. This is coming out of communications research. What policies will be put in place? How will they impact my livelihood and sense of well-being? Dan Sarowitz has argued this point, and Dan Hicks has described science controversy as proxy politics for that reason. So when the public are arguing about technical minutiae around climate modeling, they're usually really talking about something else. That's the suggestion here. It's a surface level debate about technical matters and evidence, but what they really want to talk about, what's underlying that is genuine value conflict and fear for their well-being and their own or their community's well-being. Now, this can be a hard realization for some. That science cannot guide us to good policy and right action, that science doesn't neutralize political partisanship, and it doesn't rationalize democratic decision-making. It is shocking to many vaccine advocates that the scientific consensus on vaccines does not settle public concern. Instead, it gets positioned as one side of a public debate where scientific experts must insist on their legitimacy against disreputable opponents who claim to have science and moral credibility on their side. Now, we should appreciate that surprise. The consensus functions to settle debate, not to invite it. It does it by representing the majority view of those most suited to pronounce on the issue. Consensus claims can also serve a public function to educate the public on issues and promote appropriate response, whether that's personal or political response. And the failure to achieve these aims is frustrating, no doubt. Some people will ask, doesn't the consensus deserve more deference? It is, after all, the consensus is, after all, the best approximation of scientific truth. It's produced by the best of science's truth-seeking procedures and practices. The universal applicability of the findings, of course, rests in the methods of consensus building. And so for the public to suggest impartiality in that consensus statement is to reject an elaborate set of epistemic, methodological, and institutional mechanisms that are meant to ensure reliable knowledge and public benefit from that knowledge. So science isn't supposed to be something you believe in or be against, and to say otherwise is to say that science depends on trust. Now, of course, science does depend on trust. So this is what's important here. Much of what members of the public know about vaccines pivots on epistemic trust. So I say that about vaccines. The philosopher Ben Almasy has made the same point about public's knowledge about climate change. So tied to the consensus statements about vaccines or climate change and the position papers is a claim to the epistemic and moral legitimacy of its authors and the institutions they belong to. That's baked into our consensus claims. Vaccine hesitators and more strident vaccine refusers reject those claims of legitimacy. So what is the appropriate response when the scientific consensus does not fulfill its function of engendering public trust? Here's what happens now. What happens now is vaccine hesitators, vaccine refusers are ridiculed for raising concern, for questioning expert testimony, for taking seriously minority dissenting opinion. Against that democratic tenor of science that I just spoke of, science journalists now write articles like "Why You Have No Business Challenging Scientific Experts." And they do this to convey a sincere disgust over the current state of affairs. They'll ask incredulously, why would you take the word of a media savvy celebrity mom who attributed her knowledge of autism to the University of Google over many scientific experts? Fair question. We know that the consensus is an expert-generated directive for epistemically dependent outsiders. It's supposed to offer the scientific information that we need to know. However, the mechanisms used to ensure the trustworthiness of that information, so things like negotiating conflicting views at academic conferences or in expert journals, replication of findings, peer review, and so on. These are internal to the scientific community and are therefore largely shielded from public view. And so that final step in the expert-lay exchange, where if all goes well, the publics accept the scientific consensus view, requires some degree of a trusting leap of faith that the scientific experts have done their due diligence and reported responsibly. So that trust requirement, again, places the outsider in a vulnerable position. And there's no sympathy for that. The publics are then implored to trust science, trust in a process whose trustworthiness lies in it being shielded from public opinion and other non-expert contributions. So without an eye on or participation in the innermost practices of scientific knowledge and consensus building, and with various threats of sanction for not accepting the findings, the public are instructed to trust, and some are just not willing to do so. The current climate of parental decision making on vaccines is difficult. Many parents get caught up in the noisy confusion of competing claims, alternative voices from varying expertise, social media amplification, and they feel genuinely unsure about how to support their children's health. Many parents report this. With all the information out there, they don't know what to do and who to believe. So of course, those dissenting and questioning and confusing voices, they make the decision-making process more difficult, but it's due to poor trust that the institutions tasked with protecting the public good are not able to carry out their mandate by guiding parents out of that confusion and offering the definitive voice of reason. The consensus does not fulfill its function of guiding parents here. And I think we need to look at the consensus makers and ask, why is it that the consensus doesn't fulfill its role? Not just what's wrong with the public for not listening. So having said that, here are the implications I'd like to suggest for those scientific institutions who are finding themselves in this frustrating situation. I think we all agree that the publics need science, but my point is that it goes both ways. Science needs the publics too. Many institutional mandates are fulfilled only if they have good public relations. Science, of course, strives to create universally applicable knowledge, and this knowledge is universal only insofar as it is accepted by various stakeholders. So this places the demand on scientific communities to earn and maintain the trust of the public. Now, some research institutes and agencies rely on stable relations with the outside, and they don't need to do much work to maintain that. They, at minimum, need to ensure access to public research funds and to have enough trust with the public that they will enjoy little interference with their work. That's usually more abstract or esoteric areas of science. They've got that minimal level of public trust in place, and then science can operate smoothly. Now, but I'm of course looking at policy relevant science like public health. That's research motivated by practical goals, things like furthering human, animal, and environmental welfare. Here you've got much more elaborate ties to the public. These practical goals require scientific claims to be accepted by stakeholders outside of the specialized epistemic community. So policy relevant science can only provide those public benefits if its institutions are regarded as trustworthy by members of the public. Public health, for example, public health science can only improve population health if the general publics largely accept and follow their recommendations. Those health recommendations that are given to us and consensus claims they bank on the public's trust in these institutions' conscientious and honest effort to inform and protect. So earning and maintaining the public trust is crucial for fulfilling public health mandates. Offering the best science or the most carefully considered action directives is not enough. The science must be trustworthy, of course, but it also needs to be trusted by the public health stakeholders, members of the public. So persistent vaccine hesitancy indicates that there has been an institutional failure, or maybe numerous institutional failures, to engender public trust. And that warrants some self-reflection about these institutions and agencies' own trust-building practices, how they interact with the public, and what they do to deserve that trust. I'll draw it all together and just sort of summarize a little bit. So I argued that the evidence that most of the publics accept on vaccines turns crucially on epistemic trust. And it's poor trust in the expert sources that engender vaccine hesitancy. So consensus claims, even 90%, 95%, won't convince anyone if the source is not perceived as trustworthy. So laying on more studies and more studies and studies and studies isn't going to change the situation that we're in. So what if we focused on building that trust rather than educating the misinformed public or puzzling over their moral and epistemic failings? Doing this is not to discount that public health agencies may have the science on their side, but it does mean that the best science is not enough. So this is not a war with the publics or a war over science. And any public health agency that frames it as a war with the public is not doing public health. I've offered a different picture of science in relation to the publics than the firm anchor that is mooring liberal democratic political organization. Now, science should still be understood to hold firm ground. I'm not a relativist on scientific evidence, but this idea that the evidence speaks or dictates right policy is, of course, a fiction. All evidence is subject to interpretation, and political and policy decision-making requires numerous non-scientific considerations. So, of course, the language of evidence-based or follow the science is misleading in that respect. Scientific evidence operates within a constellation of social influences that guide personal decision-making as well as policy formation. And it's good trust relations that ensure that science stands prominently within the policy framework. So good relations with the public need to be maintained. The current tendency of criticizing the skeptical public for failing to appreciate the primacy of scientific reasoning, the authority of experts, it really doesn't address the problem of public mistrust in scientific institutions. If anything, it exacerbates that mistrust by entrenching a polarizing us versus them mentality. Okay, I'm going to end there. Thank you very much.
Well, thank you very much. That was really interesting. I'm just going to remind everyone to put their questions in the Q&A chat, and Maya will get to them as she can. But I do have a quick question for you from myself. You mentioned earlier that you're happy to go over, who fits the profile of these people who are hesitant for vaccinations and things. You've also mentioned how there's people, these highly educated people are also sort of in that group. I was wondering if you could expand on that a little more.
I'd love to. When I started my research into vaccine hesitancy, again, pediatric vaccine pre-COVID, there were sort of two truths that everyone knew, and I even entered the work accepting them as true because they must be true. One is that science illiteracy is the problem. Public's misunderstanding of science is the driver of vaccine hesitancy. And the second one is that it is a problem of affluence. There's social science research confirming this, showing correlation between degrees of vaccine hesitancy and household income. So there are many measurement tools that are used. They do surveys on parents, and they found higher household income, higher levels of vaccine hesitancy. And of course, I assume that was true. It's the science says so. But as I started working on my thesis, that it wasn't a scientific misunderstanding problem, and that it was probably a trust issue instead. I had the work from science studies sort of help me develop that idea. I said, well, isn't that an odd finding that the most affluent people are the least trusting of vaccines? And that goes against what we know about trust in healthcare generally. There's a large body of research on trust in healthcare, just trust generally. And they tend to find that marginalized and disenfranchised groups are the least trusting of healthcare. And that has to do with historical atrocities that have been done, research done on racialized groups without their consent, and other kinds of historic problems. But that continues into today, where people experience medical racism and all kinds of problems in healthcare. So I wondered, why would that be, that the people that benefit the most from the system are the most resistant, while the people who tend to be the least trusting all want vaccines? And the research, when they did sort of postal code research on vaccine coverage, they would find near similar vaccine coverage in the most affluent neighborhoods, and then in the least affluent, usually racialized neighborhoods too. But there was a tendency to assume one was because of vaccine hesitancy and the other was due to poor access. And I wondered, why wouldn't, at least in terms of the racialized and low SES neighborhoods, why wouldn't it be both? Because I think it should be both. And so looking into it, I discovered what happens when you do social science research without a good theoretical framework. The research that had been done, it's usually done using methods called convenience sampling, where you put up a phone number at a health clinic, and you say, anyone that wants to be part of a vaccine hesitancy survey, call this number, or something like that. And it resulted in biased recruitment. So what you got were you got the answers from the people most likely to agree to talk to social scientists, and the people with the time to agree to interviews and things like that. And this was noted in the studies. They would say something like, most of the studies I had were American, so I'm dealing with an American context here, where they would acknowledge that they'd say, a limitation of our study was that 75% of our responders identified as non-Hispanic white. And so that was recognized, but it never caused a need to sort of actively recruit racialized people, which you often need to do in social science research if you really want to get a good spread. I also found that some of the measurement tools had not been validated for racialized and inner city populations. So I imagine there were many very well-intended Masters of Public Health students who wanted to do this research, say, let's do, cultural comparison, let's do this. And their thesis supervisor would say, I'm sorry, we don't have the tools for that. So what you got was a bias sample where it did show, at least among this pool of responders, that higher SES were more hesitant. And I'd say why is that? It's probably because they've got the privilege to do that. You can do things you can be vaccine hesitant, you can refuse, you can homeschool your kids, you can come up with alternative medicine, pay out of pocket for all kinds of ways to protect your children, or at least perceive it as such. But it was missing this very important part of the demographic. So I questioned whether that was true, that it was low SES were vaccine compliant. The very little research that's been done I've only seen it on Black Americans, have showed very high levels of vaccine hesitancy towards influenza vaccine and pediatric vaccine. But there's been so little that it still needs to be established. Now, COVID, I need to jump to COVID now. They did something different when you remember there was just a ton of survey research done on who will get a COVID vaccine when it becomes available. And that's just because it was, that COVID funding just poured out of the government taps, and people did all this research. There they bothered asking a wider set of the population. And it was found in UK, in Canada, in US and elsewhere that racialized communities were the most vaccine resistant, at least at that early stage. And of course, that grabbed headline, like, wow, the people that are most affected by COVID and the people that need it the most and stand to benefit the most are the most resistant to do it. So suddenly the narrative on vaccine hesitancy shifted very quickly. And now we're seeing in all these countries good grassroots efforts to reach out to racialized communities. And we can speak more about what's worked and what hasn't. But that was a very dramatic shift that, at least as a vaccine hesitancy researcher, I was like, wow, they're actually asking everyone instead of just some people, and getting a very different picture of who is your characteristic vaccine hesitator, and of course why they're hesitant.
Great. Just going to follow on from that as well. We've got a question from Octavian. Do you have or do you know about any MDs or doctors which might be spreading harmful information?
Oh yes, they exist. We've never had 100% consensus on vaccines. There's been vaccine hesitancy and among healthcare workers always. I should say, before I go on with that, I should say that it was a real miss by the countries like UK and Canada that were lucky enough to access these COVID vaccines early. And of course, they offered it first to front-facing, public-facing healthcare workers. And they offered no communications, no rollout. They just expected that you'd finish your shift on Monday and show up on Tuesday for a vaccine. And there was shock and surprise that I think it was first personal support workers working in senior care homes were among the first, and they were actually not all lining up for the vaccines. There was, in some cases, a lot of resistance. And they just didn't prepare for it because they thought surely, I think this stems from the war on science kind of public misunderstanding theory that, well, surely they are educated, they are health professionals after all, so they will know that vaccines are a good thing. But there's always been resistance. If they'd gone back and looked, or if they'd asked someone that works in vaccine hesitancy, they would have found that there's been refusal over, let's say, flu or influenza vaccine mandates in healthcare settings, and just healthcare workers that also counsel their patients not to vaccinate their children. So why is that? Well, because you never get 100% on anything. The consensus is strong, but there are healthcare workers that challenge whether that consensus is more of a steamroll where healthcare workers have to say yes, because otherwise they're in trouble. So you get those healthcare workers that say, no, I'm not fully convinced. They can have a variety of reasons for doing that. And some of them have made a little bit of a media profile for themselves by being that sort of maverick, following on the heels of Andrew Wakefield and being the sort of parent advocate who doesn't just, follow the system and challenges power and things like that. So yes, the answer is yes, there are healthcare providers that challenge the vaccine consensus, and it shouldn't surprise us because we've never really been uniform on anything.
Okay, interesting. We've got a question here from Naomi who's asking, are you advocating compulsion?
I am in favor of vaccine requirements. However, we have to be clear about what we mean by when we use the word mandates or compulsion and things like that. I go for the lowest compulsion possible, but recognize that you will not get the coverage that you need to protect society just by making it individual choice. So the best way to get people to vaccinate is to normalize it. So where I live in Ontario, we've been vaccinating children before they can go into daycare or school since the 1960s, 70s is about when that started. So because of that, we have a norm of vaccinating. There is some opposition, but we're not starting from zero. The tendency is to do what your peers do. So that's, I've already spoken to the sort of social ties and things like that. So mandates serve that function. First of all, they tell the public that it's important. That's why we're doing this. And they also normalize it because most of your friends will end up doing it. Unless you live in one of those pockets where the norm is to resist and to fight it, but most don't. So mandates are important and necessary for that. If we need, let's say, I was working on pediatric vaccines. If we need 95% coverage to protect children from measles, you're not going to get it just by making a good case to every single parent. So you need that. But I am also strongly in favor of allowing exemptions to do that, because the last thing you want to do is make any requirements seem so heavy-handed that people are going to fight it and get radicalized about that. And we've seen versions where that did happen. Prior to COVID, California is a good example of that. They were having trouble with outbreaks. Remember, there was a Disneyland outbreak and everyone was sort of scandalized about that, and a lot of resentment towards low vaccine coverage among sort of rich coastal communities, the Beverly Hills, Malibu. So it was creating the sort of class tensions too around vaccine coverage. So the state sort of, the government, state government recognized that the political will was there to do something about these rich Malibu people. And they created the strongest vaccine mandates that have been seen, at least in the US, where there were no religious exemptions and no conscientious or philosophical exemptions. And what that did, of course, it increased the number of vaccinated children in kindergarten, but it also resulted in a lot of children being pulled out of school to be homeschooled. And of course, that's a worry. Some homeschooling works out fine, but some kids fall through the cracks because they're not getting, proper schooling. And it also radicalized the base such that when COVID vaccines were presented, even before they existed, the anti-vaccine movement in California was very well organized, and they have put up fights over masks and vaccines and things like that. So you don't want your mandates or I prefer requirements. I won't go into why. It just captures the broader range. You don't want it to make people so angry that they push back. You want it to be just enough to push people in there, but you probably need to allow for some exemptions. They can be difficult to get, 8 signatures, watch a video, make it as bureaucratic as possible to get those fence sitters in favor of vaccinating, but leave those release valves available. That's actually, a public health officer once used that term, called it a release valve. You've got to do something to let that anger out. Otherwise, you've got this sort of radicalization that can actually make things worse.
A bit of a follow-up question there from our viewers. Do you think compulsory vaccine passports will affect COVID-19 vaccine take-up rates, particularly for those who might be vaccine hesitant?
Yeah, I think these vaccine passports are going to, and I think they're coming. I mean, I think there's already versions of it in the UK, I understand. Anyway, I won't go into what they are coming. Whether they're here yet, they are coming because we, at least at present, don't have a better way to figure out how to get life back to normal. So I think, the details still, we're still not sure how equitable it will be, but there will be versions of that. So the vaccine passports are, of course, going to make some people more willing to vaccinate. It's going to go in both ends because they want to go to stadium events and live in university dorms and things like that. So the people that are already fairly happy about vaccines will see this as a good reason to do it, but it's also going to make people angry. So you're going to get it in both directions. The best thing we can do, and this really is the best thing that we can do if we have something like a passport, is make it as equitable as possible. So there are equity issues around around, let's say, racialized communities that are already over policed. So they wonder who's going to be checking my passports, and will you be checking my passport as much as you check other people's passports? And history tells us that it will not be equitable unless we do something about that. If we just leave everyone to check passports, it won't be done well. There always needs to be an or what. So all of our passports, our requirements, our mandates, it's always show vaccination or be vaccinated or what. In healthcare settings, nurses who refuse to get influenza vaccine need to wear a mask during influenza season. So that or what, sometimes there are fines that you pay. Sometimes it means you're excluded from certain events. If it's things like going into a shopping mall, maybe that's tolerable. But if it's things like children being excluded from education, which they have a right to, we've got to work out, ways to take care of that in a more equitable way. It still remains to be seen. I can't give you an answer beyond that, but yes, they are coming, and yes, they need to be done carefully, because people will fight that just like they fight other vaccine-related legislation.
Okay. We've got a question here from Miriam. She asks, what do you think about Jennifer Wright's claim that vaccine hesitators are acting as selfish agents, taking advantage of others who contribute to herd immunity?
I find that too strong a claim. Yeah, I'm familiar with Jennifer Wright's, it's not exclusive to her. Her work was on vaccine hesitant mothers in Colorado, and they did fit the profile of affluent mothers who invest a lot of resources into their children. And because of that, they've got the resources to work around vaccination problems. So these are the prolonged breastfeeders, organic food, homeschoolers. So of course it's a function of privilege. And I appreciate her work for sort of characterizing the function of privilege and how that can actually enable vaccine hesitancy because you've got outlets for that. And it sort of fits with a sort of general characterizations of in the sociology of mothering around, the term for that is, I'm forgetting the term for it, but pretty much it's a sign of success especially among affluent mothers, to invest a lot into your kids. So to be on them and worry about them a lot and do a lot. You have to be in some kind of active mothering. However, I am resistant to characterizing the needs of women, even affluent women, as trivial or frivolous. I think that gets us into sexist territory that we don't want to get into. As far as I see it, even these affluent mothers are making a demand about health and equity that they are not able to fully work out by themselves. So I see vaccine resistance as largely being a justice issue. It's a justice issue among racialized people who don't trust the system and don't trust the government, but it's also by women, all women who are, let's say, have had poor healthcare experiences around childbirth, which is not uncommon, who have gone to their doctor to talk about vaccine concerns and have been shut down and made to feel stupid for asking questions. Also the mother blaming that happens around mothers and vaccine choices. Of course, people will make all kinds of decisions and sometimes they'll go badly. So I don't want to get into the pointing at affluent mothers and saying somehow their interests are not important here. They may not exercise it in a way that I agree with, but I don't think it is mere selfishness that's happening. I think they are really making a demand for something that they're not able to get. So, when you read some of those research, they'll say things like, I don't trust pharmaceutical funded research. And that's not unique to affluent mothers, that's across the board resistance. Now, why is that not a legitimate concern? Why is it not legitimate that they experienced an epistemic injustice when their doctors wouldn't talk to them about their vaccine concerns and made them feel stupid? So these are, of course we live in an intersectional world where we feel and experience injustices in different ways, but I think these mothers have at least some stakes that they are trying to pursue. It just doesn't always come out in the right way.
There's sort of an expanded question here put forward by Tilly, who asks, how far is the marketization of health responsible for mistrust? For example, people thinking that someone's just out to make money on this kind of thing.
That is a very big part of the problem. I mentioned it in the previous response, but I'll say it again. The concern that pharmaceutical funded research and technology is not trustworthy is so pervasive. I mean, I think we all kind of know that pharmaceutical, except for the, current glorious Moderna, Pfizer experience that is happening right now. It's kind of this is a new thing that now pharmaceutical companies are seen on the side of angels. Not that long ago, they were the least trusted industries, sometimes worse than oil and gas, as bad as governments. There's all these national surveys on public attitudes towards different industries, and pharmaceutical companies always at the bottom. And, you don't need to look very hard to see where that attitude comes from. We've had some scandals. And when there's been inquiries into the Vioxx and the Celebrex and opioid crisis and medical devices, I mean, I could go on. It's usually found that the profit motive of pharmaceutical companies corrupted the research and corners were cut and things like that. So I don't think it's irrational to say, what if that next thing, whether that's a COVID vaccine or something else, is going to be the thing, the next scandal. And we'll, of course, only find out about the harm after the fact, after there's many deaths and a government inquiry and things like that. So I don't think it's irrational to think that there is the consumerism and healthcare often don't go well together. If anything, I would say this is back to the institutional implications that I spoke to, this is a time to really shore up public trust and credibility. And if the publics are telling you that the current relationship between industry and healthcare practice is not acceptable, now would be a good time to change it. I know that's a tall order, but we're dealing with the need for, a global vaccination movement, and even within our countries before, around pediatric and influenza vaccine. And if you don't have the public on board, you have to ask, why don't we have them on board, and what do we need to do to fix that? So one way to fix it is create more distance between industry funding of research and the research done itself.
You're really getting me thinking about a lot of things here. So we've got a question here from Kate, who says online misinformation around vaccination has become more widespread during the COVID-19 pandemic. Does your research give any indication of its influence upon public trust in vaccination? And to what extent do you think social media and online platforms can have a positive role to play in rebuilding this public trust?
So a question to ask, back to thinking about that, we have these very capable public health agencies who do a lot of communications and put out consensus papers, or at least position papers on things that we need to know about, like vaccines. Why is it that that's not enough? So there's been studies of parents and the kind of work they do to figure out what to do for their kids. And apparently they do visit the sites of, the CDC or the various national public health agencies, and they are not satisfied. They don't end there. So what is it about the consensus claims and the messaging that the sort of traditional or orthodox experts are doing that isn't seen as enough, that parents somehow perceive? Let's assume these are well-intended parents, not stupid, certainly want to do the best for their child, that they think that there might be more to the story that is not being disclosed. And I think the sort of industry influence might be part of that narrative. Also, the communications are usually very broad brush. I remember looking at various public health communications around vaccines. So I went to the CDC website and looked up measles vaccine, mumps vaccine, and it was just like a boilerplate statement like, the MMR vaccine is the best way to protect your child against mumps. Next page, the MMR vaccine is the best way to protect your child against measles. And it wasn't recognizing that parents are looking for different things. Of course, they want a trustworthy statement like that. Hopefully they trust that. But they have all kinds of interests, like a lot of parents want to know about the different vaccines. So it is the case, if you actually look at what vaccine hesitant parents would say, that they're like, but why do we vaccinate against rubella? Isn't that excessive? Is that really dangerous? Maybe my kid only needs this vaccine and not another. And the fact that you couldn't get that at the agency websites said to me that the communication strategy isn't very good. But you know where you do get that information? It's on those vaccine skeptical websites, which they do a lot of good. They are like, some of them are stellar communications people. They use the language of informed consent. They validate the experiences and knowledge of parents, especially mothers who I just mentioned might have felt like they were stupid or selfish. And they actually provide the breakdown of information. They also never call themselves vaccine refusing. They say, we are pro-information. Parents, you know, as good parents, you want information to make a good choice. We trust you to make a good choice. Now, I get why public health agencies aren't going to say, we trust you to make a good choice. But if they framed it more as, here is the information you want to know, then we would get a lot further. So because the communications among these sort of traditional expert sources don't go very well or don't provide it, then people go online. And then you can find all kinds of information. I spent a lot of time on those websites, and especially late at night, you can eventually get convinced that maybe I've been wrong all along. Then I'd wake up the next morning and realize that no, I think I just went down a rabbit hole. So there's a lot of information. The fact checking doesn't seem to do that much. It gets information off the web, but then it just gets picked up somewhere else and new versions come up. So that kind of discrimination of information doesn't seem to have much of an effect. But what it does do is it takes people's eyes off this information that can lead them in different directions. Now, people are using social media. You asked about what can we do to fix it. They're trying to divert social media eyes towards more validated sources. So maybe that'll have an effect. I don't know how to measure that exactly. They're also, we're hearing now, especially as they start rolling out COVID vaccines for teenagers, they're using social media platforms to actually get to teenagers, like, you know, TikTok videos and things like that. And it might be convincing. I guess it depends what they say.
Okay. Do you think offering financial incentives could be an effective way of encouraging vaccine uptakes? That's a question from Becky there.
Turns out all incentives can have uptake. You need to do it right, because people will get offended if it seems too trivial. But you know, we do a lot of things for incentives. So as long as it's kind of done carefully and not and isn't in a way that people are going to find offensive, yeah, it will probably help. I know that's already happening. These kind of incentive structures. But I will say one incentive structure that I found really compelling. This happened in the Canadian province, Saskatchewan, that's sort of West Prairie wheat country, where the province, they're doing their vaccine rollout, and the premier of the province put out a sort of multi-step plan and said, hey, if we get, I can't remember what his numbers, let's say 90% of our adults in Saskatchewan vaccinated, we get to move to step 2. And step 2 was about having a great summer and opening things up and having fun and things like that. So it was actually a collective incentive instead of the usual, here's $5, will you get vaccinated now? So it was bringing in a lot of things together, including the strengths of vaccines, which is really a collectivism, much more than the individual. So I was interested in that version. So I'm just saying that because I liked that version of incentives, but of course incentives work, they always do.
I mean, that'll do it for me as well. Got one more question here from Octavian, who's just asking about the fairness of people who are vaccinated still being able to infect other people while they're traveling, or if they're going into these places where there might be, you know, these COVID passports and things like that. What are your thoughts on that?
The fairness of vaccinated people infecting others. I got to say right now, the research is indicating that is very low. So we're seeing the extreme version of, so we know these vaccines work really well. That's great news. We've seen the extreme version in the US where they said anyone who's not vaccinated doesn't need to wear a mask anymore and can go about their life like pre-COVID times. And apparently the science supports that. The communications was a mess, however, because of course now all the anti-mask or non-vaccinated are saying, great, I'm not going to wear a mask either. And of course, now we'll never know who's vaccinated and who isn't. But at least the CDC was well intended in their communications disaster by suggesting that the chance of transmitting, a vaccinated person transmitting COVID to another person is extremely low. So I'm going to leave it at that until the science says otherwise. I think we need to say that it's probably a very low risk and we don't need to worry about it very much.
That sounds great to me. I don't want to be worrying about anything like that.
Yeah.
We've got no more questions left. So I think what we might do is we might say thank you for a brilliant talk and for answering all these wonderful questions as well. And yes, thank you very much. Any final thoughts before we head off?
No, I don't have any. Thank you so much. Thanks for attending, everyone.